on March 20th, 2020, we began placing people in this hotel. We filled the entire 45 rooms in 2 days. The Margarita Inn is a hotel-based shelter. Households, individuals, couples can live safely with a door, with a lock, with a bed.
One of the things that I really love about the Margarita is the day-to-day is so variable. I really think that one of the greatest gifts that we can offer at the Margarita is reconnecting people with community.
The well-being that we're able to provide for people while they're here is really key to their successful housing search. Connections for the Homeless began as a shelter operator back in the late 80s. We operated out of a church basement. When the pandemic hit, that no longer became a feasible way to operate shelter. We had been calling around in the community to see if hotel operators would rent us hotel rooms. We had gotten kind of hard nose from most everybody.
I'm Lauren, and I've been at the Margarita Inn now for just about a year. This time last year, I was being treated for metastatic stage 4 prostate cancer. You know, finding the Margarita, it's not just the idea of like a warm place to sleep and, 3 meals, which, of course is important, but just everything else that was here. It really was providing something for me that I didn't really even know that I needed, which was a medical respite.
Zoning is always an issue amongst shelter providers. Zoning laws and ordinances made it very difficult and very expensive for us to operate this shelter.
I think if you ask people whether they were in favor of affordable housing, they'd say yes. But when you propose a project next door to them, they may not be in favor of it.
Evanston is a community with a lot of engagement. It's a community where a lot of people express a lot of opinions. There has been some tension over the years between some neighbors and the Margarita Inn.
We needed to get what was called a special use permit. The public notifications went out, and community opposition arose very quickly thereafter, and that is kind of a universal experience of shelter operators. There's always a battle that goes along with making sure that we can serve the people that we need to serve. That battle, I will put it that way, took a couple of years. It cost us over $1.5 million. It extracted an enormous toll on the morale of our staff and our residents who were told they were unwanted.
Approving this is not going to do anything to all these homeless people in all over the United States.
Open your doors and be transparent. This will never work in this community, and we'll never accept it.
It's a grave disservice to the homeless.
I think doing anything significant, achieving any level of greatness, certainly blazing new trails, we will always be met with opposition. And I think that you have to live with a bit of expectation of it.
One thing I'm so proud of is that we managed to mobilize the many, many, many community members who supported us.
It's important, I believe, to stand up and do the right thing. I said, how about if I bring a bunch of my neighbors and we all stand up together and say, we support the Margarita.
We've always been impressed with the work that Connections for the Homeless have been doing in Evanston. So the county stepped in and partnered with Housing Forward and Connections for the Homeless to buy facilities so that they could deliver services within this shelter.
I remember the phone call that the purchase had gone through, just the amazing release that felt. What I was most impressed by was that many who had opposed the purchase of the Margarita Inn stood in celebration with us that day at the press conference.
Through discussion and collaboration and problem solving, the Margarita Inn has really become not only an accepted, but more importantly, an appreciated and cherished part of the neighborhood.
If other communities are doing what Evanston is doing, that would be a huge step forward around the country.
We're all in this together. Healthy communities are diverse communities in every way you can think of. It's our obligation to house our fellow residents.
We've now had 5 years of operations here. Our success rate at getting people housed is roughly twice what it was. We have 24/7 staff, a staff physician, we have an on-site clinic here, we have behavioral health specialists that work with the residents, we have all kinds of recreational activities.
Right there. All of those wooden ones and the shiny ones. 1, 2, 3.
Feeling less isolated is really impactful. We had volunteers whose interests were knitting, and now we have a knitting group that people love to attend.
Really, we talk more than knit. You do sort of develop somewhat of a friendship, so to speak.
All right, thanks, Sally. Oh, how funny.
It's very, very important that this was a safe space. There is something kind of special going on here at the Margarita because, you know, when I started my cancer treatment, I didn't have any guarantee what was going to happen. This is a place that allowed me to heal, to rest. It looks like that I am on track to become cancer-free.
Not only could this be, revolutionary for us as an agency, for the city of Evanston, it could potentially help other agencies around the country deploy a model like this.
Finding the Margarita Inn and coming here probably saved my life.